Thank you, Gal. Hi, Tamara. I wish I had good news, but you have breast cancer. These were the words of my surgeon over the phone as I sat in my car in an Aldi parking lot on a crisp, sunny day in December 2019. Good afternoon, everyone. I am Tamara Pryor. I am a holistic registered nurse, a cannabis nurse and educator, and I empower women to shamelessly use cannabis as medicine. From April 2020 to August 2020, I chose to be treated with chemotherapy to rinse my body of any potentially leftover cancer cells. This was a challenging time for me for some obvious reasons, but a few challenges I wasn't prepared for was a decreased libido, relentless vaginal dryness and bleeding, and pain with intercourse. My healthcare team provided a little information about sex while on chemotherapy. Don't have sex the day of or the day after. Was all I got. The first time my husband and I knitted our souls together. Yes, knitted our souls. I brought that beautiful term from an amazing therapist, Burl Armstrong. Thank you, Burl. The first time we knitted our souls together, it felt like something I never wanted to experience again. It felt like my vagina was the thinnest piece of paper you could ever imagine, and someone was tearing it from top to bottom. And as kind and gentle as my husband and I were to my body during that experience, relief and pleasure did not show up for me. Once the knitting was complete, I got up to go to the bathroom. Ladies, you know how important it is to urinate after we knit. As I was urinating, I realized that the feeling of my vaginal tissue tearing was spot on. As the urine trickled down, I realized the opening of my vagina was torn and bleeding. It felt like my perineum had been set on fire. After that experience, not only was my desire to have sex pretty non existent, but the anxiety that would swell up inside of me just before my husband and I would have intercourse was so overwhelming. Prior to my diagnosis, my libido showed up on rare occasions as a busy wife, mom, daughter, sister, friend, and full-time employee. Quite frankly, I could take it or leave it. And this had caused many years of arguments off and on between my husband and I. And some would say, girl, what's the problem? You have a legit excuse now. Wrap that out. But instead, anxiety set in. I was afraid that we would drift apart. But what I knew is that my husband and I really needed this intimate connection during this time in our lives. I desperately wanted to find a solution to this problem. So I went down the chemo, sex, and cannabis research rabbit hole. And while I was down there, I found a recent study done by Stanford University that showed cannabis use increases sexual desire for men and women, and that broad terpene entourage is most effective in stimulating sexual arousal. specifically linalool, beta-caryophyllene, limonene, and myrcene. And these can be found in chemotypes like OG Kush. One woman was quoted as saying, well, if I smoke marijuana or use marijuana, then I can have an orgasm or my libido is better. Danielle Brand, the author of Weed Mom, stated, inhaling the fragrant smoke, my endocannabinoid receptors are massaged and my sense of touch is ignited. And the serum's effects are like sprinkling of fairy dust on my sensitive parts. And I wanted some of that fairy dust. Another piece of evidence I have considered was research that was completed in Mexico. And it reviewed the effects on the sexual function of women with the use of THC. The data showed that the effectiveness may be dose dependent. So lower doses improved sexual desire. So I said, okay, I'm headed down the right direction. Then I needed to address my pain. For the relief of certain kinds of pain, I believe there is no more useful medicine than cannabis within our reach. Sir John Russell Reynolds, neurologist, leader in epilepsy research, and physician to Queen Victoria. After reviewing what felt like was hundreds of research articles to determine if cannabis could be an effective pain medication for my pain, I discovered that a recent report published by the National Academies of Sciences, Engineering, and Medicine found that adults suffering with chronic pain who were treated with cannabis are more likely to have a significant reduction in pain. And another recent research report concluded that chronic pain patients who were prescribed hydrocodone were less likely to take their pain medication if they had access to cannabis. Some research has shown that low doses of THC can be effective in alleviating anxiety. According to Dr. Dustin Sulak, the health benefits of CBD include anti-anxiety, enhanced mood and sociability, impulsivity, increased sex drive, blood flow, and arousal. So after gathering evidence on the great potential of this plant being able to address all of my issues, I needed to determine which would be the best method or methods of consumption for me. So I looked at all of the consumption options that I was most comfortable with: oral, topical, smoking, flower vaping, and vaginal suppositories. I knew I needed sexual desire, lubrication, relaxation, and pain relief. And although there isn't a lot of evidence for the benefits of vaginal suppository, Michelle Ross notes in her book, Vitamin Weed, that there is some evidence that has shown cannabis suppositories can help the individual relax before sex and can be effective in increasing libido and alleviating pain without the head high. I also found that the authors noted in their book, CBD, A Patient's Guide to Medical Cannabis, that delivery of cannabis via rectal and vaginal tissues provides patients with greater absorption and bioavailability of the medication. I wanted to be able to meet all of my needs with one method, if possible. And I wanted this process to be as simple as possible because I'm a minimalist. After considering all of the possibilities and my intentions, I finally decided on vaginal suppositories, which I can use as a topical also. Finally, I needed to determine the best formula, meaning CBD to THC ratio. Anecdotal cases have shown that the best formulation is a suppository containing a larger dose of CBD with a touch of THC. So I took this information into consideration and did the exact opposite. I came out of that rabbit hole with a recipe for a vaginal suppository, and I got to work in my kitchen with a double boiler, coconut oil, and a bit of CBD, and my girl Jenny Kush. So how can you go about making these or accessing some safe organic suppositories? Well, I'm glad you asked. At that time, I had a difficult time finding vaginal suppositories online with the chemotype that satisfied my intentions. However, I was able to find a recipe online that enabled me to create what I desired. And I'm a DIYer, so it all worked out. But today, if I prefer not to make a DIY product, I would just Google vaginal cannabis suppositories for sex. And I'm confident that I would come across some pretty great products that are organic and safe. However, I Googled vaginal cannabis suppository recipes for sex and came across a great DIY recipe that I tweaked to make it my own. There are a couple of these suppositories. There's a couple of ways that these suppositories can be made, but I'm all for the easiest way. So here is what my ingredient supply list included. I will be sharing exactly how to make these suppositories at an upcoming webinar, so look out for that. So my ingredient supply list included organic coconut oil, cannabis concentrate. I chose Jenny Kush for her promise to provide soothing relaxation and elevated mood. CBD oil. I chose Hawaiian Haze for her beautiful offering of effects of feeling happy, relaxed, and social, which I interpreted as frisky, and I'll take it. I'll take frisky. Very few supplies and ingredients were needed, keeping it simple and cost effective, but still providing me with a safe, necessary, and quality medication. So when it came time to try out the suppositories, I gently inserted one and applied just a bit of the oil that was left over on my fingers to my clitoris and labia and my labia. About 15 minutes later, I felt sexually aroused. After about 30 minutes, I was relaxed and lubricated and ready to take charge. Not only did I not experience any pain during or after our soul knitting session, but I had absolutely no pain or soreness the next day. The vaginal suppositories turned out to be the healing balm I needed. I am so grateful to be able to have access to such a beautiful plant. My husband and I are experiencing the connection we longed for and truly needed. I am now experiencing none of the pain, none of the fear, and all of the desire, intimacy, and pleasure. And you deserve the same soul knitting experience. Thank you.